Robert, your smooth music is started. It is lovely. Hello, everyone, and welcome to our March 10th end+disparities Learning Exchange office hours entitled African American and Latina Women's Health and Stigma. I'm Michael Hager. I'm the Manager of Technical Assistance and Dissemination at the National Quality Center, and I'll be your facilitator on today's call. So one of the things that we like to do is just to collect a little bit of information about who's on the line so that it kind of jogs our memory later. I think that we're a small enough group that we can also just do a voice introduction on the phone as well. Yeah, having the information in the chat room is just good, again, to jog our memory when we're looking at the notes and the transcript later on to see what we thought. So I'm Michael Hager. I'm with the National Quality Center. We're based in New York. I'm the lead for the end+disparities Learning Exchange, and I'm really excited by all of the work that we've been doing so far around this initiative and excited for our third month that focuses on African American and Latina women. So Beverly, do you mind introducing yourself?
Sure. I'm the Regional Coordinator with the Bureau of HIV STD Field Services for the New York State Department of Health, and I'm in Albany.
Great. Thank you and welcome. Dawn.
Hi, I'm Dawn Trotter. I am a consumer and I work with Evergreen Medical Group as one of the retention support assistants. I'm actually also one of the learning exchanges and the disparities folks.
Thanks, Dawn. Dilcia.
Hello. My name is Dilcia Tejada. I work for ImediaCare. I'm the Quality Assurance and Training Manager, and we're based off New York City.
Great, welcome, and thanks for joining us.
Thank you.
Emily.
Hello.
Hello.
Hi, sorry, I was on mute. Hi, everyone. My name is Emily Chen, and I'm a program fellow here at the National Quality Center, and I've been helping Michael a lot with the end+disparities Learning Exchange, making sure everything's running smoothly. So, yeah, glad to be here and to learn more about Stigma.
Great. Thanks. Nishi.
Hi, I'm Nishi Parkinson from St. Louis, Missouri, Washington University School of Medicine, Project ARC, AIDS Resource and Knowledge. I am the consumer liaison for the St. Louis region. I'm also the spokeswoman for the end+disparity campaign, and I also sit on the tag for the N2c. Welcome, everyone.
Welcome, and thanks for joining us, Nishi. Michelle.
Hi, I'm Michelle Mohammed. I am a program officer at the Baltimore City Health Department, so we do program administrative side as well as quality improvement. And so I'm in Baltimore, and good to hear from you all.
Thanks for joining us. Nanette.
Hi, everybody. My name is Nanette Braymagnani, and I'm an N2c coach for Mississippi and Louisiana, Eastern Pennsylvania, and New England, and Western New York.
Thanks, Nanette. Always awesome to have you on the line. Absolutely. Robert.
Robert Bobo. I'm from the Comprehensive Care Center, Community AIDS Network of Sarasota. We have 24 clinics throughout the state of Florida, and I'm located in Northport. And I miss being up north in the Northeast. I want the snow.
You do. Be careful what you ask for. Welcome. And Charlonda.
Hi, my name is Charlonda Pierce. I am a HIV Contracts Manager for Ryan White Part B here in the state of Minnesota.
Welcome. Midwest love.
Yeah, and I do not want it to snow.
I'm sure you're done with it for the year.
Right.
Welcome. Sonia.
Sorry, I had it on me. This is Sonia Contreras. I'm with Dallas County Health and Human Services Quality Management. I am the health advisor here at Grants Management.
Great. Thank you so much. Welcome.
Thank you.
Stephen, you're muted. Maybe you can unmute and introduce yourself.
Sure. Good afternoon, everybody. My name is Stephen Bodie. I'm a AmeriCorps member at HRH Care, and I was advised by my director to listen in on this webinar.
Great, welcome. So great that we have a young person who, like Emily, is getting ready to join the workforce and is learning all he can. Thank you so much for joining us.
No worries.
And Tasha.
Good afternoon. This is Tasha Traylor. I work with Ryan White Grant Administration in the Harris County Public Health area. I'm the project coordinator for Quality Management and Development here in Houston, Texas.
Great, welcome. And we have Judy and then Caroline.
Hi, this is Judy Popkin. I work with N2c. I'm the coach for the states of Florida and Georgia. And thank you for having me. It's a pleasure to be on the call.
Always a pleasure to have you.
Thank you.
Caroline.
Hi, my name is Caroline. I'm a non-medical case manager with FAHAS, which is an HIV/AIDS support service in Fredericksburg, Virginia, which is kind of in central rural Virginia.
Great, thank you so much and welcome.
Thank you.
And there's one more person on the phone who I don't know who that is, area code 845790. Go ahead and introduce yourself.
Good afternoon, this is Dorothy Alexander. I'm from Mecklenburg County, Charlotte, North Carolina, the Ryan White program, and I'm a contract coordinator.
Great, welcome. And there was one more person trying to introduce him or herself.
Yes. Hello, everybody. My name is Nalo Hampton. I am a medical case manager for Hudson River Healthcare in Dutchess County in the Mid-Hudson Valley.
Great. Well, we have quite a wide range of folks here. We have lots of impressive agencies represented from many parts of our country, and we're really hoping that we can share a lot today with each other and get this conversation going on how we can address stigma and help African American and Latina women's health and end disparities. So for those of you who are joining us who are less familiar with this initiative, the End Disparities Learning Exchange is a 9-month voluntary improvement activity where we've invited all the Ryan White programs from around the country to join us in an educational series. We're focusing on 4 subpopulations and trying to think about disparities specifically for them, but of course anything that we do with these 4 populations can extend outside. If we apply the same type of critical thinking and strategic planning and root cause analysis that we're doing with these 4 populations. So if these populations aren't necessarily those that you see at your site, you can still learn a lot from participating in these calls, I believe. The End Disparities Learning Exchange video is a great way to get people excited about ending disparities. It's available on our YouTube channel here, or you can find it on our website, end+disparitiesexchange.org. It's just a short 3-minute video that really eloquently frames what we're trying to accomplish here with this initiative. Office hours are always on Friday at 1 p.m. It's a variable schedule. We don't have them every week because we don't want to be having too many events that would take away from your busy schedules. But the idea is that there's no registration and it's open to anybody. And instead of having a really firm set agenda, what we're trying to do is to focus on a discussion and to have a dialogue between consumers and providers and policymakers to think about key issues. And today's topic is African American and Latina women's health and stigma. So let's talk about this. This is a question of the hour. We have folks represented from around the country, and I think one of the things that I would like to start with is just to kind of get a sense from folks. What are the key contributors to stigma for African American and Latina women in the Ryan White HIV/AIDS program where you're located?
Hi, this is Dawn. I know one of the big stigma issues in Buffalo with women in the Latino and African American is that they seem to, when I talk to them, they say that it seems like that only people that are drug users, or it's usually a MSM issue, so they don't really want to talk about it because it shouldn't really be affecting them. And if it is, they feel like they're going to be stigmatized, like they had to have gotten it a certain way because this is how it's portrayed in their community.
Uh-huh. That's very good. Absolutely. What are some other ideas from other parts of the country too?
So this is Bubba, and I've working in rural parts of the state of Florida. I have to agree with the young lady that just spoke. Is that since the epidemic, people look at it as a gay disease or an IV drug user disease. And not only do they have a problem talking among themselves, but even with their partners, because they feel that, it's something that they shouldn't have. Partners and
providers. Excellent. Absolutely. Thanks, Robert. What do some other folks think?
This is Nishi from St. Louis. With today being National HIV Women and Girls Awareness Day, it brings back that women at the forefront don't believe that women who have been diagnosed with HIV over a period of time, it's not who we are, it's the things that we did that put us at risk. So those risk factors look really different for a lot of people around the country. And women that are HIV negative, they can't even begin to wrap their brains around how could you live 20 years or how could you live 17 years? What was the momentum in your life that was the driving force for you to have a win-win situation with a manageable disease? And the lack of education that people are still receiving around the country is not there yet.
Great points. Thank you very much.
Hello, this is Nalo from Hudson River Healthcare.
Hi, Nalo.
Hi, everyone. I think for women outside of our facility, which is called Genesis, I think they still experience a lot of discrimination, sometimes within family, their own family, sometimes going to other providers that are not well-versed in HIV prevention or health care. And I think that is a big struggle because oftentimes what happens is they feel isolated and they are not able to verbalize their concerns about their own health. Mm-hmm. Yes, when they're in the office, it's one thing. But when they go outside, when they reach out to others, because stigma is still so prevalent within our community, it's hard for them to make human connections with other people. And it's often very difficult for them to make connections even in healthcare facilities outside of what we offer.
Excellent point.
And this is Dawn again, too. I wanted to say also what the stigma comes along with what she said. When women would like to, on the outside of, the clinic setting, maybe possibly have someone to talk to, if they don't have a peer in their clinic, or I noticed in Buffalo, we really don't have a lot of women's support groups where we can go and talk about the stigma and feel comfortable and free to discuss it. So there hence becomes the problem where, again, you become bottled up, you don't feel like you have anyone to talk to, and people are scared that, disclosure of people keeping their status, in that room, so it keeps them, kind of behind the closed door of the stigma of what will happen if people find out.
Great. So one of the things I'd like to point out is that, we have folks participating in the discussion from, the north and the south, from urban and rural, and it sounds like many of these issues are very similar in terms of, the availability or the lack of availability of a peer support process, whether that's a formal group or an individual, is a really important barrier for women. And similar to what many of the groups, this is the third month that we're focusing on a specific population. Trans folks and MSM of color representatives said very similar things about perception and about, feeling judged or fear of being judged on entering a door. And I think that those are really interesting parallels that seems to be like a human nature thing that is beyond just a single population or a single locality, that these are human issues, that I want you to see me and not make assumptions about me or judge me before you even met me.
And Michael, with that being said, I think that prevents a lot of women in the African-American community from stepping into a medical facility. You know, they may have been going to this medical facility for quite some time, but to get the actual test done, that's a stigma within itself, because they're not coming in for a regular well woman's exam, you know, at that time. It's like the trust is being, you know how some clinics lose the trust of their patient relationship with their providers. Like once I step on that other side, if I'm a woman being diagnosed with HIV, how would you even perceive me after the fact, knowing that I'm a woman living with HIV now? But I've been coming in your clinic all this time, plus years, 15 plus years, and this one test comes back positive. That changed the mindset of that young woman wholeheartedly, and it makes her feel like she's not wanted, she's not accepted, no matter what her income status is, no matter what her education status is. Being diagnosed makes you have a whole gamut of things come through your brain at one period of a time, and it's quickly. And for us as women, if we don't already have a family and we want a family, you go into that mindset, can I be like someone else? Can I be like the next woman?
You know, something resonated with me just now, and what you were saying, Michael, and what everybody's saying is that we have peers at our facility, and oftentimes the people who step up are young MSM to do peer work, and it's awesome. I think, again, who was it that just spoke? Was it Dawn?
Nishi.
Nishi, yes. It's very true, in fact, that women feel judged, and they do feel stigmatized. And I think even in my own caseload, so many women have a powerful story to tell, but I think they often hold back from stepping into the peer spotlight because of that stigma. And I mean, it's such a powerful testimony to who they are, and to be able to share their struggle with another woman or other people would be a beautiful thing to see, and would get us a lot further in ending the epidemic. But I think, again, a lot of women are hesitant to step into that role because of prior treatment and because of, you know, discrimination, for lack of a better word, or for feeling a certain way, or for people making them feel a certain way about their diagnosis. We have a very small town here, and a lot of people know each other and know providers and know. So again, that makes it a little more challenging, but I think there is opportunity for women to step up into that role. And as we fight stigma and fight a lot of the stereotypes that happen, I do see a lot of wonderful things that can happen in the future.
You know, I want to kind of pick up on that, Dorothy. One of the things that I think about sometimes is for these folks that are in smaller communities that, you know, kind of I'm
sorry, that was Nalo, not Dorothy.
I'm sorry, Nalo.
It's okay.
For folks that live in, you know, these type of tight-knit communities where that barrier can kind of be a brick wall to break through. It's a really tough barrier to get through. Do you think that there are ways that as agencies within these small towns, we might be able to connect with agencies on the other side of the country or the other side of the state in small towns so that women can share their stories with other women, but to women who they'll otherwise never, ever, ever meet? You know, in a way, kind of creating an information exchange that protects the privacy and the concerns of the women who are sharing. I don't know, it's just an idea.
kind of awesome.
Michael, this is Nishi again. I think that will be well received. I'm not sure who the young lady was that just made the comment. Bringing women.
Oops, I'm getting a little bit of feedback. Let's. Right, go ahead, Nishi. I'll try to stop this one.
Okay.
Okay, go ahead, Nishi.
Being brought into a space that is safe speaks volumes to women to really discuss the real approach of sociology, economics, and stigma to ultimately end the disparities that we have across the continuum. And when I say the continuum, it's nationally, it's internationally, because I know for us as African American women, some of us have a perception that other countries, other women from other countries will not lean into our liking because we're two different dynamics. But with that being said, we can run this race together and beat the odds together in the momentums to make a stronger Women Now movement because that's so needed, because we're already divided based on geographic and economic status and income status. But if we all came together as one, it would be just so rewarding to have that dialogue and have that platform built, or we can talk about those things over a period of time and see the wonderful trends that may come out of it. To have more peer components for women, to have more driven force through the Ryan White services to say we need this funding for women to step up to plate to be peers in their communities or in their countries. Because, you know, when I was diagnosed in 1997, I met a case manager on a weekend. I didn't have the peer component until probably maybe 6, 12 months down the road, but it really wasn't called a peer component at that time. It was a young woman that was just in the clinic, and she was volunteering her time to reach out to individuals to give her empowerment and her impactfulness that she had to get her through what she went through, and she manifested it in me. But it took probably 2 to 5 to 6 to 7 years before I actually really got linked with a strong woman that was in an actual peer role. So times have changed over a period of time. Like Dawn said, we don't have a lot of women that come to the forefront to be that strength under that peer role. We're always looking, you know, for women to step up to the torch and lead this torch because it's so needed. It's so needed.
Thanks for that, Nishi. You know, we're going to be talking later on. In the last 10 minutes, I'm going to go through a slew of websites that I think help to get at some of these concerns, you know, as far as training and leadership development and, you know, just a whole bunch of resources. But, you know, I'm really interested in hearing other folks' thoughts. And so if as we're talking, you already know about a resource, feel free to chime in or just enter it in the chat room. And definitely when we're in the last 10 minutes of this webinar, what we'll do is have the opportunity to kind of navigate and go to more sites. It's been pointed out that the slides aren't being shown right now, and that's because as an informal discussion, what I thought would be more productive would be for all of us to see me taking notes, you know, on this discussion. And of course, these notes will be distributed with the chat transcript after today's call. But I just wanted to kind of point that out, that there really aren't slides because the focus really is a discussion amongst all of you on the line. So that being said, I'm wondering if folks, you know, kind of picking up some of these threads here that from the conversation around perceptions of judgment or that type of thing leading to stigma. What are some of the solutions that we can think of that might help to work around those perceptions? Are there trainings or anything that anyone's aware of?
Michael, I'm not aware of any trainings. but earlier you talked about safe spaces and connecting rural with urban and what have you. I remember that the University of South Florida had a SPENS grant to do that in the state of Florida, and I never found out what really happened with it. They ran into roadblocks at the agency I was at, but I still, was sort of curious about that. And I wanted to make the comment, seeing as there's people from HRSA, from the HAB on the call, it would be really nice. I keep hearing more and more encouraging things about peer programs throughout the state of Florida and throughout the country. We need to maybe start encouraging folks to direct some funding that way.
Mm-hmm. Thanks for making that comment.
This is Dawn. I know it's LTI in New York State. LTI Chickatelli has a sort of peer training component that they have that they offer to consumers that are positive. It's like a self-management training that they offer in increments, and then after the consumer takes these allotted amount of trainings and they graduate, they're able to actually become mentors, which basically are peers to mentor other positive people in their community, in their area. So I don't know, for anyone in New York State, if you have a consumer who is positive and you think that they are ready, because again, the consumer has to be ready to be a part of a program like that, that's available. And I know also, I believe last year, I was a part of a spin-off project, was with a clinic out of New York City, and it was just a peer phone line where they connected me up with peers that actually, like Michael said, I never saw. We just talked on the phone a couple times a month, and it seemed to help. I got a lot of great feedback on some of the consumers saying, it was just nice to speak to another woman who was positive and who knew, and, we so much have to meet face-to-face, but, it helps to be able to talk to someone like yourself. So, if maybe possibly there's more programs like that available, I think that would be great to look into.
Thanks, Dawn, and thanks, Robert. I've added both of those to the list of sites that we're going to cover at the end. Dawn, the Chickatelli Associates Learning Training Institute, and Robert, the SPINS Women of Color Initiative. We'll talk about at the end as well.
Hi, this is Charlonda. Oh, go ahead.
Go ahead, Charlonda. I'll speak after you.
Thank you. I'm sorry about that. This is Charlonda in Minnesota, and one of my areas that I need some suggestions or best practices on, I have an ASO who is struggling to recruit a diverse candidate population to better service their diverse, population of consumers. So I'm wondering, how do we help create that diversity in the workplace to better service the population that we serve?
Excellent question. Has anyone, been involved in any type of leadership development and recruitment for diversity initiatives?
It's not recruitment for diversity initiative. This is Nishi from St. Louis again. But we've recently, I've worked on a team recently. We are currently in the process of hiring peers for a position here in St. Louis. I found something new this week, but I hear some background noise, so I'm not sure if I'm distorted or not. I don't know if everybody can hear me.
Yeah, I went ahead and muted that line. Thanks for that.
But with the hiring process, what our HR team did is, because we cannot outright ask in the application process if a person is living with HIV. So they correlated a question, and I don't have the question at hand, to allow the person to identify through their cover letter, to tell their story or to talk about their status in the cover letter versus keying the information inside of the database that is set up for applicants to actually apply for the position. So they came up with a creative way to not discriminate or go against the grain for HIPAA violations within the university. So that was something new that I learned this week because we were really going off of word of mouth, or I'm telling someone, I'm emailing them, hey, we got this peer position that's readily and available that came available, can you apply? That was one of the snazzier ways that we did.
There we go. Sorry about that, Nishi.
I hope they caught the last end of it because I was trying to talk over it.
Do you mind just repeating it just in case?
So what we did was the individuals would talk about their status and their life of living HIV positive in their cover letter. So they came up with a snazzy little question, and what I can do, I can give Michael that question that they actually asked in the interview. He can send it out in the email to someone once I be able to put my hand on that actual question that they posed for the applicants to go ahead and venture in their cover letter with that information so that we can know that these are the candidates that are persons living with HIV.
Wonderful. Thanks, Nishi. And I know that Tasha is burning to speak next, but I'm just wondering if anyone else has any other solutions to Charlonda's question around how do we ensure a diverse workforce?
Hi, this is Dawn. I know Nishi said, they use word of mouth at first and then they figure out a way to kind of word it. But I've noticed as I've worked in this field over the last few years, word of mouth actually is a great way to find prospective people to work as peers. Because, who else to know peers than other peers that have spoke with them. We've actually had a position open up here, and basically how we got resumes is by word of mouth. We knew what the position curtailed, and we talked to people that we thought would be possibly good for the position. And some of, again, like Nishi just posted, case managers know, and they just let them know the information. We've had providers say to their patients, listen, we're looking for a peer that, is positive to help with their peer population. So sometimes word of mouth is the best way to go. So I don't know if that helps, but that's actually how I got my position here, word of mouth, because someone heard that I was volunteering at another clinic. So.
Thanks for that, Dawn.
Michael, this is me.
Oh, sorry.
No, go ahead.
Also, you can go, like, if you have your community advisory boards in your community or small support, your planning councils, you can always utilize us. We send out a quarterly newsletter for the Missouri Response Team, and I can probably put you in our consumer corner because that newsletter is circulated around the nation. So that's another snazzier way to get the word out as well.
And and I think that with the cabs and the consumers, with the diverse clientele, when they start putting pressure upon the administrations of whatever clinics, that they want the providers to look like them, I think administrations have to stand up and take a look at it and listen to them.
Mm-hmm. Hi, everyone. This is Justin from D.C., and I just quickly wanted to add, in D.C., we've done a great deal expanding our peer programs and kind of ensuring that we look like the populations we serve. And I think one of the key things that I want to add in addition to what everything has been said is you got to give people a chance to develop. So really do trainings, give people an opportunity to step up. And I think I know from the work that I've done, it's surprising sometimes where people you may have never even found of word of mouth, even kind of sometimes word of mouth reaches the same folks over and over again, where new people step up if given a chance.
Great, Justin. You know, I saw a couple of comments in the chat room about that same issue, that, you know, we have sometimes small communities and a couple of ASOs competing for all the same folks who are the word of mouth folks, and that's a really great point that you just shared. So
just really quickly, Michael,
go ahead.
I wanted to say too, here in New York State, for what Justin said, basically for them to be ready, and people you may not even know that are ready. So New York State has now started a New York State peer certification program where we're certifying peers throughout New York State to be able to work as certified peers in clinics and things of that nature. And it's a lot of trainings that they can go to, and this is something that they can do on their own. They sign up. There's no pressure. And once they're ready to go into the workforce or maybe possibly be that face, they're basically built up for it. They've built up their self-esteem and their knowledge to work that position.
Hi, so this is Judy. It was my understanding, because I inquired about that, because obviously I'm in Florida and Georgia, but I was told that people could still sign up and take the online training, but of course they couldn't be certified because they're not going to be working in New York State programs. But I don't know if that's still true, if there's an overwhelming response or a room, but for other places that don't have that same course offering, it's still open or may be available to others.
Well, yes. I mean, if they're going to be in New York State, because right now I guess a lot of the courses, and I'm on the board, so I'm going to give you the information that I can give you as far as that point. The courses are offered in New York State, throughout New York State, Rochester, New York City, Syracuse. So if a person is able to get to the trainings or take some of the trainings that are online, sure, but yeah, they would not be able to be certified unless they were a New York State resident at this time, and also they have to have an agency backing them, saying that, okay, once this person is certified, we, are willing to look at them for employment or part-time volunteer position in that nature. So as of right now, it is New York State certified, but I hope it will become state, United statewide. I would love for that to happen.
That would be great.
Great. So I've added that as another resource for us to share in about 10 minutes. And I think, actually, Dolores is on the line. I think that I've unmuted you. Hi. You're calling us from the Bahamas.
Yes, I'm now in Fort Lauderdale, but I wanted to make sure I joined this conversation. And I've been on a while and really hearing about the resources and some of the comments that Nishi has been making. I wanted to comment. For women, it's very difficult. We're not a cohesive group, and we have a lot of priorities that are more family-based. And so even though I've been working for the last several years with women and trying to build coalition, it has been very difficult because of all these competing issues. And I think that's one of the things we need to explore, to really hear from women what would work for them. Right now in North Carolina, we are hosting a feminist movement building workshop through the International Community of Women Living with HIV, the North America region. And it's been so difficult because women are not used to coming together and working together and being a cohesive advocacy group for the issues that impact their life and their families. And so I really want to hear what women across the country think or suggest around that. And when it comes to work, I think there needs to be real effort to build the capacity of women, not only in there are many organizations that will take you on and offer you training, but I think there need to be more resources added to formal training so that women can move up into these capacities. Because I think women are best to support women and to achieve the goals we want. So those were the comments I wanted to make.
Thank you so much for that. And I think Tasha had her hand up before, so I'll turn the floor over to Tasha. And Tasha, if you have any suggestions or solutions for the question that Ms. Dolores just posed, we're very interested in hearing that too. But go ahead with your initial question.
Basically, here in the Houston area, we're extremely diverse, and often it's not just African American or Latino. Sometimes we have Black Hispanic women, so it can be a combination. But we also have a large West Indian population, Jamaican, Haitian. So the Black culture is very far-reaching, and it's not homogenous. So one of the things we were discussing in a meeting earlier this week, a training we had, was the extracultural issues of that. We have persons who are in the African community here who may not feel comfortable disclosing status because their community is very tight-knit and they're afraid other people wouldn't know. So the stigma is definitely very apparent, but here in Houston, the landscape is very different. We're a large metropolitan area, as many of you may know if you know the Houston area. But we also have, like I said, the issues and I would say areas that we navigate within our Latino and Hispanic communities too. So, it's very far-reaching. One of the things we've done specifically with Ryan White Grant Administration Part A is we are funding an outreach category because we'd like to look at how linkage and retention changes with regards to having case manager roles, but those that aren't tied necessarily to the office. So we are piloting this right now. And also, I'd like to invite one of the individuals, actually a couple of them from our Planning Council's sort of subcommittee. It's an offshoot. It's called the Positive Women's Network. And these are heterosexual women who are of all backgrounds, but the two people I'd like to invite are the lead, who is African American, and the sort of her vice chair is a Hispanic woman. So she's actually multiracial. She's half Mexican and half Chinese. So I think they can really speak to what we're dealing with for the rest of March. And I'd really like to just invite them to the call next week to join. So I'll do that this week when I see, or next week when I see them, to see if they can provide a unique perspective as positive women who are navigating these issues. Cool. Okay. Thanks for letting me speak.
Thank you so much. Yeah, I know it's great when there's that problem, right? Like so many great ideas and suggestions that it's hard to get the floor. And thanks for grabbing it, Tasha. I completely agree. I love Positive Women's Network. I think it's an enormously important organization, and I've enjoyed working with them. It's one of the resources I was planning on sharing. And just to kind of see, is anyone else on the line part of the Positive Women's Network?
I am not a member of the Positive Women's Network, but I am working side by side. And I am the Women's Network. I attended a wonderful conference in Fort Walton Beach, Florida last year, and they made me cry from day 1 to day 5. It wasn't even 5 days, but I cried all the way coming home. Just the momentum and the uproar of the women and their momentum and them being valued, and the breakout sessions that I attended. I still grab that Positive Women Network brochure that I was left with And I had a wonderful opportunity to sit down and re-engage and really shift gears for myself to see where I need to be actually plugged in my community. So I'm working behind the scenes with one of the Positive Women members to try to cultivate a new PWN here in St. Louis, Missouri. We have Latricia, who spearheads the one in Kansas City, but I really want to hopefully get one right here in the heart of St. Louis, because I know so many women will be touched by it and be able to come out and blossom as flowers and dynamic women that we are. So had an opportunity to be with Dolores and some other women as well. And it was just phenomenal. I don't know if Dolores is still on the call, but if she wants to chime in.
Here. Yeah, no, I mean, when it comes to women-specific organizations, right now, PWN are doing a phenomenal job, and you know, and their focus is primarily advocacy, and really building capacity of women around advocacy and the issues that impact us. And there are many, especially when you look at trauma and the impact of trauma in the lives of women, especially violence. These are issues that are important. I think that as we look at the life of women, we have to look at it more holistically and look at the intersecting issues that impact our lives, such as criminalization, stigma, and violence, and you know, the list continues. But until we address all of those issues, I don't think we're going to get the success that we want, especially when we look at disparities, because those are the things that are impacting the lives of women.
Very well said. Thanks, Dolores, and thanks, Nishi. Dawn, I don't know if there's anything that you want to add as another member of the network.
Well, I've just recently joined within the last 6 months, so I'm getting, you know, just taking in the information that I'm learning. And again, like I said, they have a training that they just offered for a year-long training on advocacy and, you know, how to be a great advocate and things of that nature. So I applied for that because I think that I would like to become more active in the advocacy part of, you know, my work. But I believe what I saw, that they are a great organization. They have great resources, strong women, and people that if you want to connect with someone who can uplift you and give you some hope and strength and let you know that we can make it, this is a great organization to link up with.
Wonderful, thanks. And Sarah, thanks for all you do with Positive Women's Network in Louisiana, too. I don't know if you want to just give one example of how the network has helped you with women in your area in Louisiana.
Yes. Okay, can everybody hear me?
Hello.
Hello. How are you?
Good, and
we
you?
are working hard in Louisiana because it's so hard with the stigma, as I heard you all talking about. Mm-hmm. But we pull our positive women together and give them strength and encourage them and teach them how to advocate for themselves and speak up and be heard.
Great, thank you very much. I'm just going to mute that line with the jazzy music. All right. So what I'd like to do now, as promised, I want to go through a bunch of resources with everybody. So this is not an exhaustive list, and as I mentioned before, please go ahead and add additional things in the chat room or just holler them out if additional ideas occur to you while we're working our way through. But here's the Positive Women's Network. It has a lot of information on this website. Dolores, I don't know if there's anything in particular that you want to call out as really important or really a great way to focus on some of the concerns we've been discussing on today's call?
Well, I think right now, when you look at PWN activity, they're mobilizing women, including policy issues.
Hold on just a moment. I'm going to go ahead and mute someone's line.
Okay. So they're mobilizing women around some of the policy issues, especially around what's going on with the Affordable Care Act And I think women at every level can begin to participate, especially when you think about your access to health care and how do policymakers' decision impact your access. And so it really is an opportunity to go on that website and to be galvanized by what's going on and to become aware. A lot of times it just takes, you know, a small action such as calling your local legislator to say, you know, this is how this situation impacts me. This is how, you know, this action will affect my access to health care. So there are multiple actions that are online at PWN that you can look at. There are other organizations that you might also want to consider. You might also want to consider the International Community of Women Living with HIV, which is a more global organization. But as somebody mentioned before about the diversity of women where they are, and that is so true. One of the issues for women is that we all come from different cultural backgrounds, and those culture impact how we work together. And so sometimes it's good to look at a more global perspective. The issues are the same, believe it or not. So that's one other resource I would add to the list.
That's fantastic that you mentioned that, because I actually, go ahead.
The website is imicw.org.
Yes. And just so that everyone knows, all the resources that we're sharing, you can see I have quite a few tabs open here, so we're going to work our way all the way down the line. And I'll share the entire list as part of the chat transcript as well. Of course, you can share before that if you'd like, but we'll share that. This is something that came across my desk just yesterday. It's a Women's Health and Activism Summit here in New York. It's by New York Knows, which is part of our End the Epidemic initiative here in New York State. And the city has broken down each of the 5 boroughs into New York Knows, Staten Island Knows, Queens Knows, Bronx Knows. So New York Knows is putting on this activity at MIST in Harlem on Saturday, March 18th. Tickets are completely free, and both breakfast and lunch are provided. And the goal of this is a discussion around wellness and community and how to provide emotional and professional support to women in these organizations and people of color justice organizations, because our mission and our activities are kind of coming together here and have been coming together for a while. So this is a really exciting training that our friends at the City of New York wanted us to share on today's webinar with all of you, for those who might be able to make it. So we had talked a little bit about—
Michael,
go ahead. Yes?
Also, sorry. Especially for the people in the Northeast, Iris House has an annual women's conference that does a really good job of looking at the various issues that intersect for women. And I know that their conference is coming up, I think, in May. So you might want to also add that to the list. And that's Iris House in New York City.
Thank you. We're creating a list through this initiative of all the conferences that touch the populations that we're trying to serve. And thank you so much for raising that, Dolores. I have the link up here now, and that will end up going in with all of the other items that I share after today's call. The training is May 4th at Bethel Gospel Assembly in Harlem. Okay. Next, we have the Integrating HIV Innovative Practices. This is something that came out of a SPINS project as well. And you'll see that there is an implementation guide for engaging women of color. This is something that is more from a provider's perspective on how we can make sure that women of color that we're working with as patients are engaged and that we're addressing some of the many issues that we discussed on today's call. So this resource is available free of charge and will also be shared with everyone on today's call. Next, the leadership training, transgender women of color living with HIV. This is really exciting. It's a brand new training that that's been rolled out. I know that there are a number of other leadership trainings that are like it. You can see that this one actually is already passed. It was in San Francisco in December, but we're keeping really close watch on these trainings as they are developed. I'm not sure if anyone on today's call is involved in the development of any of these trainings. Do we have anyone involved?
So I am not directly involved, but I do know that U.S. people living with HIV caucus are very involved in the leadership training that's supported by a grant from HRSA. So you can definitely follow up with them to find out more information on that. And again, it's the U.S. people living with HIV caucus.
Wonderful. I'll definitely look into more information there so we can share these timely and not after they've occurred. Another SPINS initiative finding. This one is, I believe, related to the work that Robert had mentioned, SPINS Women of Color in AIDS, Patient Care, and STDs. This is another guide that's available free of charge to the Target Center, and we'll be sharing this after today's call as well. Here we have a link to the New York State Department of Health peer certification, and you can see that there's a lot of resources here. So in addition to the wonderful information that Dawn shared earlier on today's call, you'll be able to click through and read a little bit more about what's involved. Since the state here in our offices helped to develop this too, if you're working with another state or with another city and you'd like to think about creating a project like this or a process like this for your locality or region, hit me up and maybe we can find a way to connect these dots so that you can talk with someone here who was instrumental in creating it here so that you can import it into your own region. Next, this is the Leadership Training Institute that Dawn had mentioned. Ciccatelli is a global public health consultancy that does a lot of work with the AIDS Institute here in New York, and they have a number of resources and trainings that are available for people living with HIV. So there is a listing of the archived webinars so that you can watch these at your own desk, at your own time, or on your own couch in your own time. I know that many people have found these to be really, really wonderful and helpful engagements. Of course, we wouldn't be worth having a talk about stigma if we didn't talk about the stigma assessment and the stigma index. This is an index that is of, by, and for people living with HIV. It's a survey, I'm sorry. And people living with HIV are trained by other people living with HIV to deliver this survey. That same group that Ms. Dolores mentioned before, the U.S. People Living with HIV Caucus, is the group that manages the deployment of this survey in the United States. And so we can hook you up with them, or we're happy to be kind of the interface. If you're interested in learning more about this, definitely read about it or contact us, and we can hook you up with them to see about making this a reality in your locality.
I'm on. This is Ray Welsh. I'm on the Northern Jersey. I'm one of the interviewers.
Oh, great. Hi, Ray, and thanks. What's that been like so far for you? And do you think that this is a worthwhile process that other folks in other parts of the country should try?
I think so. However, I've been pleasantly surprised to find that in clinics across the board, most people have been treated fairly well from their perspectives. The places where we're finding most stigma is among family and friends, according to most of the interviewers. And the couple incidents of stigma that I found inside of clinics and doctors' offices seems to go along income guidelines instead of color or ethnicity or any other type of reasoning.
Fantastic, and thanks for that sneak preview in terms of what you're already seeing in northern New Jersey. If I'm not mistaken, this is something that was rolled out relatively recently, and so to already have this type of information at your fingertips to think with folks within other Part A jurisdictions or with the state in terms of how to direct funding, how to shift policy, how to develop certain trainings or conferences that address these issues, that's pretty exciting.
Yeah, it is.
Wonderful. Oh, I didn't talk about the Health Policy Project. So the Health Policy Project is the opposite side of the coin to what we were just talking about with the index. And this is something that providers can do within their own shop to assess how much stigma they have as providers in terms of serving their patients and clients. It's designed for the health a clinician setting, like a very clinical setting, but it's easily adaptable and doesn't lose validity when you try to shift it into medical case management. It can be adapted further into non-medical services, though the validity starts to flag. And ultimately, this is something that I believe our friends in New Jersey have also championed, though it's also been implemented in parts of the South as well. When you take this survey assessment, it breaks down the different domains where you have stigma or discrimination within your providers going to your patients, and helps with training and education through toolkits. So everything is very well packaged together here. The assessment, how to deliver the assessment, what to do with the information, and then what type of interventions you can employ at your own site to help improve those results. I don't know if anyone on the line has any experience having done the Health Policy Project in their setting or if they're gearing up to do it now. All right, so we'll stay tuned on that one. I see that we're over for time, so that's why I'm rushing a little bit. I apologize, my friends. Again, a reminder that you'll receive all of these in links in an email that I send later today. So here's another resource I wanted to share. The End+Disparities Learning Exchange did a literature review as we were initiating. And if you go to end+disparitiesexchange.org and then click on interventions, you're brought to this page. You can then scroll by population. So we click population, and then we can click African American Latina women. And then we have a number of different interventions that we can put in place for our African American Latina women. There are details on what's involved with this, in addition to resource links. Some of these are going to end up being scholarly articles. Some of them are going to be reports. And of course, if you have any questions or concerns as you're navigating any of this, you can contact me, and I'll be more than happy to connect you with folks who are responsible for bringing us this work, or I can hopefully answer your easy questions. The last resource that I want to share today is our N2c Share Lab, which is a place where people can go and enter information about the interventions that they're trying in the field. And you don't even have to have a registration. You can see I'm not logged in right now in order to search, and you can search for a term like women, and then all of the interventions that affect women are posted. So here is some stuff that comes from South Carolina. Here's one from New Jersey. Here's one from Puerto Rico, and I really encourage you to make use of this resource by searching for terms or by navigating to them, by following this tree and looking at outreach and, barriers cataloging, for example. Okay. So that is our talk for the day. I don't know if there are any other questions or concerns that anyone wants to raise before we go, but I'm really excited by the discussion that we had. I think that we covered a lot of ground and have a lot of interesting threads that we can choose to pursue in the blue text here.
I agree.
Thank you.
Yeah, does anyone have any other questions or concerns before we part ways today?
No, thank you.
No, thank you. That was a great webinar.
That was wonderful. Thank you so much.
Thank you, everyone, for joining us, and we can't wait to see you on our next one next week. Thursday from 1 to 2:30, we have our African American and Latina women main webinar, and we have a great presentation with consumers and providers and researchers ready to answer questions and to dive a little bit deeper into this issue. Thanks again for joining us, and we'll see you next time.
Thank you, Michael. And everybody remember
Thank you, everyone.
again, everyone.